Hi, I'm Larry Dignan, and we're here with Taylor Smith of Honeywell. And Honeywell's formed a lot of public-private partnerships in terms of vaccine distribution. So we're going to talk about iteration and basically what the company's learning so far. Hi, Taylor. Thanks for joining us.
Thanks, Larry. Thanks for having us on today. Really appreciate it.
So I know you're doing some vaccine distribution in stadiums and working with a bunch of different states, and industrial IoT comes into this mix. So I guess for starters, let's just start with the background. How did all this come about?
Yeah, I mean, it really came about just a couple weeks ago, where obviously our CEO got in touch with some state officials, some other CEOs local to the Charlotte area, and we really formed a public-private partnership with a local healthcare provider, Atrium, with some sporting event arenas here, with kind of Bank of America, Charlotte Motor Speedway, kind of Tepper Entertainment, and obviously the government to really help coordinate the goal to deliver 1 million vaccines by July through some mass vaccination sites at those sporting event arenas.
And I guess what's fascinated me about the vaccine distribution and the whole category of management software at this point is basically you're trying to connect everything from legacy systems to processes to data to follow-ups, a lot of moving parts here. So how did Honeywell kind of look at the moving parts as a system and try to figure out what to do?
Yeah, you're absolutely right. There's a lot of legacy. There's a lot of new systems as well. And really, the first step that we took was to do what we call site walkthroughs. So as soon as we found out about this opportunity, we went on site to a number of Atrium existing vaccination clinics to see what is the process that they're going to have to follow to scale up at these large facilities. And we quickly identified that, at least for the purpose of this mass vaccination, that there's several kind of key areas if you break them down. One is kind of patient appointment scheduling and kind of pre-check-in registration to do as much as you can before you get to the site. The second is really looking at the logistics of progressing them through the site and kind of expediting that vaccination. And the third area is how you can accurately and efficiently get that data into the state systems and other kind of master systems of records. And so that's really how we broke it down. And we came up with a number of solutions, iterating over a period of days to get them ready for the Speedway vaccination last weekend. And then are continuing to iterate as we get ready to go live at Bank of America coming up this weekend.
And what are some of the nuances in terms of platforms and systems you use? Like, can you use something out of the box for this management and distribution?
Yeah, I mean, I think it's the typical 80-20 type rule, right? We leveraged a lot of the existing systems and solutions we had, but there's obviously some kind of configuration or optimization for the specific use case. So one example is a solution that we have from our building technologies called ProWatch. It's artificial intelligence-based video analytics. So we provided the cameras and the intelligent software behind that to monitor traffic flow. So as cars are pulling up, because this was a drive-through clinic, we're now able to detect wait time, queue time, looking at where there were bottlenecks, and then we would dynamically change that throughout the weekend on where do we need more lanes, where do we maybe need a different checkpoint to increase processing time. So that's just one example of where we're using existing technology and just tweaking it a little bit to really solve the purpose at hand. And there's probably quite a few more that we could cover as well.
What about the supply chain angle?
Yeah, supply chain is obviously a challenge, particularly when it comes to some of the temperature controlled storage requirements for some of these vaccines. For the purpose of the mass vaccine type capabilities, we have not kind of gone directly into the supply chain of the vaccine per se. We've gone into the logistics and supply chain of day of events, but we do have solutions really connected all the way through the Internet of Things here, such as temperature and humidity monitors for in-shipment transport, CO2 monitors to make sure that the dry ice that's being used is not sublimating too much and causing kind of toxic environments, and really a broad-based track and trace solution that can connect any kind of unique ID from a point of manufacturing all the way to the point of consumption. So we are engaged in other areas of the vaccine kind of supply chain and other industries in that sense, but specific to what we're doing in this public-private partnership, it's really around day of event logistics and data capture and throughput processing.
What were some of the surprises from the first pilot you ran?
Yeah, I mean, one of the big aha moments was you talked about old systems and new systems. Atrium has a very robust kind of internal medical record system that has all the data that the state's looking to capture. And so that's what I would call kind of the legacy system. The state came out with a new system to capture and aggregate all of the vaccine demand to help with those broader supply chain logistics that you were talking about. But because of that iteration, because of the speed, there was no mass import capability yet into that system. It had to be manually entered on a web form. And when you're processing thousands and thousands of patients a day, that can get very intensive on the back end data entry of having several people, or several dozen people really keying in information. And so that was one area that we identified kind of a bottleneck for processing. And we came out with an automated barcode scanning solution that really took that patient entry time from 5 to 10 minutes down to under a minute for Atrium and their workforce over that weekend. So that was kind of one big aha moment, is how to provide that data processing faster.
So the web form, I mean, I've seen this in numerous states, including the one I live in, where, I mean, actually I saw one county that asked us to print out a PDF, fill it out, and then email it back. Fortunately, they went with a Google form, but I'm not sure that really gets us there either. So, I mean, how much of this distribution issue is really about data management and just kind of scaling things?
Yeah, I mean, that is probably one of the more challenging parts, because again, every hospital or once it gets out to broad-based pharmacies, they have all their own systems, and part of it's awareness for the community as well to know if you're eligible to get the vaccine. But I mean, just like you mentioned, we also took another application from a recent acquisition of Sign that provided that experience that you just identified as a mobile app as well. So when you kind of pre-schedule through Atrium, you then get a kind of text message or mobile app kind of alert or interface to fill out some additional questions that are needed for the pre-screening and arrival. And then when you show up at the point of the event and check-in, you now have kind of a very simple green or red. Do you go into the low risk or the at-risk lane from a vaccination standpoint? And that helped kind of speed up that processing as well, because you weren't having people fill out forms the day of. You were able to quickly process and identify and allocate which lane they should go down. So it's those continued learnings that we continue to work through, and we're continuing to tweak and refine as we go into this weekend's event as well.
What do you anticipate as, like, I guess, what problems do you see arising as you scale into, full-blown stadiums and speedways? And, I mean, some of these places are large, which is good for drive-through.
Yeah.
But what are some of the unique challenges of those venues?
Yeah, I mean, one is just the sheer size of the facility and volume, and it's really the people or workforce management. And so we're beginning to look at other real-time locationing systems that we have to monitor volunteers. I mean, if you look at a clinic that may have a few dozen employees and volunteers and operators to a site like a Speedway or Bank of America, where now you're talking several hundred volunteers running around and replenishing the vaccine supplies, looking at handing out personal protective equipment because you need surgical masks as you come through, not the standard cotton masks. One area that I wouldn't say is necessarily a challenge that's not insurmountable and that we're already driving some iteration there is around that workforce management. And the other, which we'll see, which we've done some preparation for coming into the stadium, is it's no longer going to be purely drive-through either. There's going to be some walk-in type capabilities, and how that manages it now, where it's two different modes, car or kind of on foot, and we're working through and planning for that as well.
The foot traffic, that kind of brings a whole unique challenge to it completely. I mean, I guess cars are self-contained, they're kind of socially distanced already. What are some of the logistics things to think about as people start walking up to venues?
Yeah, I mean, where you look at the kind of the checkpoints and the check-ins, obviously having the appropriate personal protective equipment, which Honeywell is providing, kind of our masks and other type of equipment to the upcoming patients as well as the volunteers themselves. Looking at some of the video analytics that I mentioned with cars, and can we actually monitor the social distancing aspect of the patients themselves when they're in queue? So we are exploring different ways to solve that through technology, or also just kind of pure equipment and having that on hand from a usage standpoint.
So in terms of, I guess, iteration, right? When you start a project like this, do you go into it thinking there's a certain round of iterations where you think you'll really hone the process and, kind of perfect it? I mean, is it 3, 4 times? Is it this
Yeah,
kind of journey, it never ends? I guess, how do you go into it thinking?
yeah, you absolutely have to iterate. You're not going to get it right the first time. We didn't, at least from the time that you develop it. And just to put this in perspective, I think we made the announcement on a Monday or Tuesday. We had our first kind of big kickoff meeting with Atrium on a Friday, and that following Friday, so a week later, actually Thursday, less than a week, was when Charlotte Motor Speedway to process 16,000 patients kicked off. So we had a little bit less than a week to come up with some of these first solutions. And the way that we drive iteration is don't expect perfection the first time, but get something out there that you can test. And it wasn't testing for the massive kind of vaccination. It was, okay, we found out on Friday, let's develop and iterate over the weekend jointly with Atrium. They were a great partner, and get something where they can test in their small clinics on Monday. And we did that. And we found some stuff that was wrong and didn't quite load the data properly or didn't quite perform the analytics correctly. And we iterated Monday, Tuesday, Wednesday. It was probably right around the 3 or 4 times, like you said, but did that rapidly, once a day, sometimes twice a day, to a point where we had a really successful go live on Thursday, continued to make improvements. So by the end of the weekend, we were even driving kind of more efficiency and exceeding the kind of throughput by 7 or 8% at the Speedway than the original target was.
So how many employees did you have to throw at this?
I mean, it was definitely a team effort. There was a lot more employees involved on kind of on-site logistics and volunteering day of than necessarily required to pull the technical solutions together. As I mentioned, it was kind of an 80-20. We had some of them existing already. So a lot of it were kind of small scrum teams that could anywhere be kind of 5 to 10 people for that week sprint across 3 or 4 work streams. So.
Okay. Anything I didn't ask that I should have, or any other key points about this project?
No, just really appreciate the time today. Really wanted to thank everyone that's been part of these events and coming in the future as well. And we look forward to a successful event this weekend here.
All right. Good luck.
Great. Thanks, Larry.